Inflammatory bowel disease, IBD. What is inflammatory bowel disease? Inflammatory bowel disease, IBD, is a term for two conditions, Crohn's disease and ulcerative colitis, that are characterized by chronic inflammation of the gastrointestinal, GI, tract. Prolonged inflammation results in damage to the GI tract. What are the main types of IBD? We will explain major points of both types. Number 1. Affected location. In Crohn's disease, it can affect any part of the GI tract, from the mouth to the anus. Most often it affects the portion of the small intestine before the large intestine, colon. Ulcerative colitis occurs in the large intestine, colon, and the rectum. Number 2. Damaged areas. In Crohn's, damaged areas appear in patches that are next to areas of healthy tissue. In ulcerative colitis, damaged areas are continuous, not patchy, usually starting at the rectum and spreading further into the colon. Number 3. Inflammation. In Crohn's, inflammation may reach through the multiple layers of the walls of the GI tract. In ulcerative colitis, inflammation is present only in the innermost layer of the lining of the colon. What are the common symptoms of IBD? Persistent diarrhea, abdominal pain, rectal bleeding, bloody stools, weight loss, fatigue, and urgent need to have a bowel movement. Constipation. What causes IBD? The exact cause of IBD is unknown, but IBD is the result of a weakened immune system. Possible causes are: the immune system responds incorrectly to environmental triggers, such as a virus or bacteria, which causes inflammation of the gastrointestinal tract. There also appears to be a genetic component. Someone with a family history of IBD is more likely to develop this inappropriate immune response. How is IBD diagnosed? There is no single definitive test to confirm the presence of IBD, so the condition is diagnosed based on a combination of tests, including endoscopy, biopsy, and imaging tests. Step 1. Medical history. Your doctor asks about the symptoms you have been experiencing, when you first noticed them, how frequently they occur, how severe they are, and whether they interfere with your daily routine. In addition, they may ask about places you've traveled and whether your symptoms coincided with a trip to another country. They may also ask about the foods you typically eat and whether your dietary habits have changed recently. Some of the symptoms of IBD may overlap with other gastrointestinal and immune conditions, such as irritable bowel syndrome, or with food sensitivities and intolerances, such as celiac disease and gluten sensitivity. It's also helpful to tell your doctor about any other conditions you have and whether you are taking medication for them. If you've had abdominal or gastrointestinal surgery, these procedures may cause symptoms similar to those of IBD. Your doctor may also ask if you have any symptoms related to an immune system abnormality, such as fever, loss of appetite, weight loss, eye irritation or blurry vision, and arthritis. Step 2. Physical exam. Physical exam is done to determine whether the patients have signs and symptoms of IBD. Examination of abdomen, pressing gently to check for any pain or tenderness. Doctors may also check to see if the patient has eye inflammation, mouth sores, skin rashes, joint swelling or irritation, bleeding, or other signs of inflammation in the anus and the surrounding area. Step 3. Blood tests. Blood tests can reveal several telltale signs of IBD. These include markers that indicate the immune system is causing inflammation, and signs that patient is anemic, that is, they have a low red blood cell count, which could be a sign of internal bleeding. Low levels of iron, folate, vitamin D, and vitamin B12 indicate a nutritional deficiency and may be a sign that the intestines are not absorbing these nutrients as they should. Step 4. Stool samples. IBD affects the frequency and consistency of bowel movements. Stool tests are used to rule out infections or to assess the severity of inflammation. A stool test can also reveal the presence of blood that may not be visible to the naked eye. Step 5. Endoscopic procedures. Endoscopic procedures, such as colonoscopy, upper endoscopy, sigmoidoscopy, and capsule endoscopy, are key to diagnosing IBD because they provide clear and detailed views of the gastrointestinal tract. They can help doctors diagnose IBD and differentiate between Crohn's disease and ulcerative colitis. Although these two conditions share many symptoms, they affect different parts of the gastrointestinal tract. Gastroenterologists decide which endoscopic test is appropriate based on the symptoms, medical history, physical exam, and the results of blood and stool tests. 5. A colonoscopy. Gastroenterologists almost always recommend a colonoscopy to diagnose Crohn's disease or ulcerative colitis. This test provides live video images of the colon and rectum, and enables the doctor to examine the intestinal lining for inflammation, ulcers, and other signs of IBD. Frequently, a doctor performs biopsies during a colonoscopy, in which he or she removes small tissue samples from the colon and sends them to a laboratory for analysis. Biopsy results may help doctors confirm an IBD diagnosis and differentiate between Crohn's disease and ulcerative colitis. 5b. Flexible sigmoidoscopy. A flexible sigmoidoscopy is similar to a colonoscopy except the doctor only examines the rectum and lower part of the colon. This test may be recommended if symptoms are limited to bleeding and inflammation around the anus and rectum. Occasionally, doctors perform this test to assess how well treatment is working. Doctors may perform a biopsy during the procedure. 5c. Upper endoscopy aka esophagogastroduodenoscopy. An upper endoscopy may reveal inflammation, ulcers, bleeding, or obstruction in these parts of the gastrointestinal tract. 5d. Capsule endoscopy. A capsule endoscopy may be recommended if the symptoms indicate that the patient has a problem in the small intestine but other tests, including blood tests, colonoscopy, and an upper endoscopy, are inconclusive. The small intestine is more difficult to visualize than other parts of the gastrointestinal tract, because most of it is inaccessible. A capsule endoscopy may provide more detail about inflammation, ulcers, or bleeding than other tests and can help doctors determine if Crohn's disease is causing her symptoms. In this procedure, the patient is asked to swallow a small capsule with a tiny camera inside. This capsule is about the size of a multivitamin. As it passes through the digestive tract, the camera takes thousands of pictures that are transmitted via radio waves to a small receiver that the patient wears around his waist or place in a pocket. It takes about 8 hours for the capsule to pass through the gastrointestinal tract. It is excreted through a bowel movement and flushed down the toilet. The doctor downloads the images from the receiver, paying special attention to those that are captured in the small intestine. Step 6. Imaging tests. When performed in combination with endoscopic tests, imaging tests, such as X-rays, CT scans, and MRI scans, give doctors additional information about the gastrointestinal tract. They can reveal signs of IBD in the lining of the intestines, such as tears, bleeding, inflammation, or an obstruction. Often, imaging tests help doctors differentiate between Crohn's disease and ulcerative colitis if other diagnostic tests are inconclusive. For instance, if an imaging test reveals inflammation in the small intestine, patients may have Crohn's disease, because ulcerative colitis only affects the large intestine. Imaging tests can also be used to monitor the gastrointestinal tract and assess how well treatment is working. 6a. X-rays. X-rays are used to take pictures of the gastrointestinal tract. They are particularly useful if doctors want to determine whether symptoms such as abdominal pain and constipation are caused by an intestinal obstruction or dilation of the bowel wall. 6b. CT scans and CT enterography. CT scans of the gastrointestinal tract can reveal a narrowing of the small or large intestine, called a stricture, or an obstruction. The test may also indicate inflammation in the small intestine, which suggests that Crohn's disease may be causing patients' symptoms. 6. C. MRI scans and hysteroentterography. MRI scans are especially helpful when doctors need to visualize soft tissues, such as the lining of the intestines. They may reveal small tears or ulcers, as well as irritation or bleeding. To get a better look at the gastrointestinal tract, the doctor may ask you to drink a contrast agent just before the MRI. This is called hysteroenterography. How is IBD treated? Types of common medications to treat IBD. 5-aminosalicylic acids, for people with mild to moderate IBD. 5-ASs are more effective for ulcerative colitis, but occasionally they may be prescribed for someone with Crohn's disease. These medications reduce inflammation in the lining of the intestines, relieving abdominal pain, diarrhea, and other symptoms. 5-ASs may help achieve and keep IBD in remission. Doctors may recommend taking them daily as part of a long-term treatment plan. Immunomodulators. Immunomodulator medications suppress or regulate certain aspects of the immune system, counteracting the body's abnormal response to food and bacteria in the digestive tract. They can alleviate symptoms and sometimes achieve remission by decreasing intestinal inflammation. Doctors may prescribe these medications for long-term use in people with mild to moderate IBD. 3. Corticosteroids. Corticosteroid medications are powerful anti-inflammatory agents and are often used short-term to relieve symptoms quickly. They are also helpful when used as a bridge to long-term treatment, since some IBD medications are more effective if they are used after symptoms are under control. 4. Biologics. Biologic therapies, sometimes called biologics, are a class of medications that reduce intestinal inflammation by targeting specific immune system responses. There are two classes of biologic agents used to control symptoms of IBD: anti-TNF agents and anti-integrin medications. These medications are often given long-term, sometimes along with immunomodulators. 4. A. Anti-TNF medications, which block proteins that cause inflammation in the digestive tract. If IBD is moderate to severe at the time of diagnosis or if symptoms have not responded to other medical treatments, anti-TNFs may also be given if symptoms such as a fistula, a hole that forms between the intestines and another organ, present an immediate risk to patient's health. 4. B. Anti-integrin therapy may be prescribed for people with severe IBD whose symptoms have not responded to other medications. This therapy prevents inflammation causing white blood cells, called lymphocytes, from binding to the lining of the gastrointestinal tract. 5. Conjunctive medications. Medication that is not intended to address the cause of IBD. Instead, it may be used to resolve complications, relieve pain, or address a nutritional deficiency. Antibiotics. If a bacterial infection occurs as a complication of IBD, the doctor may prescribe antibiotics, antispasmodic agents, for abdominal pain that does not respond to other IBD medications. Gastroenterologists may recommend a prescription antispasmodic medication, which suppresses muscle spasms in the bowel, easing pain and discomfort. Pain relievers. If IBD medications don't relieve discomfort, the doctor may recommend an over-the-counter pain reliever, such as acetaminophen. Doctors do not recommend over-the-counter or prescription non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen, naproxen, and aspirin. This is because NSAIDs may increase the risk of stomach ulcers and gastrointestinal bleeding. Vitamin and mineral supplements. People with IBD often have vitamin or mineral deficiencies because digestive dysfunction prevents the body from absorbing important nutrients. These include iron, folate, vitamin D, and vitamin B12. Surgeries to remove damaged portions of the gastrointestinal tract. 1. Small bowel resection. The complications of Crohn's disease result in the need for surgical intervention. Complications include an abscess, a perforation, a fistula, or an obstruction. During the small bowel resection, A surgeon removes the damaged part of the small intestine. Often, this surgery is done using the laparoscopic technique. 2. Intestinal strictureplasty. If Crohn's disease causes a buildup of scar tissue that blocks part of the intestinal tract, doctors may recommend intestinal strictureplasty to widen the area and restore bowel function. 3. Colectomy and proctocolectomy. Colectomy is a procedure to remove part or all of the large intestine, or colon. If inflammation has damaged the rectum, a surgeon may remove it as well, a procedure called proctocolectomy. 4. Ileopouch anal anastomosis. If the colon and rectum have been removed, the surgeon may need to perform an additional procedure to help the body process waste. For people with ulcerative colitis, this procedure is called an ileopouch anal anastomosis, also called J-pouch surgery. For those with Crohn's disease, a surgeon may perform an ileostomy. To perform J-pouch surgery, a surgeon uses part of the small intestine to construct an internal pouch that remains permanently within the abdomen. This pouch mimics the function of the rectum by providing a place for waste to collect and allows people to pass waste through the anus. This procedure avoids the need for a permanent ileostomy. 5. Ileostomy. Because Crohn's disease affects the small intestine, an ileopouch would be vulnerable to becoming infected or diseased. Surgeons perform an ileostomy instead. In this procedure, the surgeon creates an opening in your abdomen, called a stoma. The end of the small intestine, called the ileum, is attached to the stoma. This allows stool to exit your intestine through the opening.